A little bit about who we are, other than just being a physical therapist and occupational therapist. Bryn Mawr Rehab Hospital is an inpatient rehab facility that treats a various amount of diagnosis, including GBS, MS, Parkinson's, ALS. We have a very interesting and unique model in the sense that we take care of wheelchair prescriptions, bracing prescriptions. We also have a lot of robotics in our facility. But what's really cool for us as treating therapists is we also have neuro outpatient therapy attached to our building. So you could be my patient, starting an inpatient, and then want to come back to our outpatient, and I can actually collaborate with your therapist on the outpatient side. So it makes for a really nice transition of care, but it also allows us to work on patients from the acute side and then on the more chronic side. So that's a little bit about us and how unique our facility is. So it's been fun talking to a lot of people here and saying, well, you're a PT, you work on the leg, and you're an OT, and you work on the arm. Like, what the heck are you going to talk about with the face? And, you know, there's more to just walking and reaching and grabbing, as you know. When the foundation asked us to put on a presentation for facial paralysis, we understood that it was a very small and unmet need for you all because there's not really that many people who address it. And I'm assuming from the group that's in here, somebody has had some kind of difficulty with facial paralysis in here. So we wanted to kind of bring a little bit of exercises, because what good therapist wouldn't give their clients exercise and treatment interventions, but we also want you to understand what is going on. Like, why are you having this facial paralysis, okay? Don't worry, there's not gonna be a pop quiz in the neuroanatomy section. It's all fun. But this is looking at when you Google facial paralysis, they're gonna give you this definition of loss of facial movement due to nerve damage, and it can occur on one or both sides of the face. And it's weakness or paralysis of facial muscles that causes difficulty with eye movements, speech, chewing, and swallowing. That's what we care about, right? Now, this is very broad. When we're looking at facial paralysis, this is all of the causes not related to GBS or CIDP or any of the other variants. So the number one reason for facial paralysis is stroke. Makes sense, right? They have facial drooping. The second cause is infection, which is where the GBS, I'm going to call it the family, the GBS families live, and we all know that most cases are due to some kind of infection. Then you have Bell's palsy, which is probably the most common type of facial paralysis people hear about, but it's actually also known as idiopathic because they don't really know why you are having some facial paralysis. Then you have tumors, like brain tumors or facial tumors that are affecting the nerves, and if there's any kind of trauma, like a car accident. So let's get a little bit more specific with facial paralysis and in GBS and all of the other variants. So it follows your typical progression of paralysis, right? So it's going to be bilateral in nature, and it's going to be associated with any kind of limb weakness. Bilaterally facial nerve paralysis is what really cues your doctors in acute care to say, let's stop here, let's do some testing and figure out what's going on with this person, because truly in the world of medicine, unilateral facial paralysis is more common, okay? So if someone is presenting to the hospital and they have bilateral facial nerve weakness, that indicates to the doctor we have to run some tests, because it could be either GBS, it could be, I think there was Lyme's disease on there, and neurosarcoidosis. There's only a few handful of disease processes that present with this bilateral facial paralysis. And then if you are really, really lucky, you guys should play the lottery, because only 6% of people in already rare disease will get this delayed facial palsy that occurs after your neurological symptoms have peaked in the hospital, okay? So really rare, but in 6% of these 27 to 50% of people get this delayed onset. So, what do you see when you have bilateral facial palsy? This patient actually is a patient with GBS, so you can see how they have absent forehead wrinkles, droopy eyelids. You don't see that they have dry eyes or excessive tearing, which is a whole nother issue. Drooping of the corners of the mouth. A dry mouth, a lot of people will say, man, my mouth is so dry, like even when I drink water, it doesn't feel like it's getting any moisture in there, or a cotton mouth. Impaired taste. Dysarthria, which is the inability to, or not inability, but the difficulty with speaking. Dysphagia, the difficulty with swallowing. And then synkinesis, which I find fascinating, is when it's a voluntary muscle contraction that causes an involuntary muscle contraction in another part. So what does that mean? I go to smile and my eye starts winking. That's not really common, but that can happen. So the neuroanatomy part. I love neuroanatomy, so I kept it very simple for everybody. And what I want everybody to appreciate from this slide is how the one nerve, let's see if I can have a pointer. Nope. Okay, I tried. But so what you're seeing in all the different colors are the different branches of the facial nerve, okay? So you can see that the different colors, and this kind of drives me nuts, and my OCD is going on high alert that the colors aren't matching, but the top part, the purple, if that part of the branch of the facial nerve is affected, that part of those muscles would not be working. So you can have either certain parts of the facial nerve be affected, or you can have the entire nerve affected. So you may see some symptoms or not. And generally speaking, the muscles of the upper part, not all muscles are innervated strictly by these branches. There are some overlaps. So again, take this with a grain of salt. It's very general, but you need to understand that you may have certain areas of the face that are not working because of what branches were affected. Now, this patient did not have GBS, but this is a good picture just to kind of show the severity of the facial paralysis. So what does it mean for us as clinicians and for you who are living with facial paralysis? Well, trivia Dave, I see you back there. This is a good slide for you, buddy. Yeah, get your laptop ready. I got some good trivia facts for you. Anybody go to that last night, by the way? It is hard. Yeah. Jeez Louise. Okay. Anyway, so we can see if we have weakened muscles of facial expression, we are not going to be able to smile, to be sad, to be angry. Well, why is that important? If anybody went to San Diego Symposium and heard Michael Coleman speak, he is an actor, and he came up to us and he said, man, is there anything that I could do to zap my face, because I play Happy on the Seven Dwarfs and I can't smile. So that really affected his role to be able to work, and that really discouraged him. And of course, when he was diagnosed with GBS was right in the middle of him filming. So they had to do a lot of, take shots from the one side of the face that was a better smile. So it can affect your life a lot if you can't express what you want to express. the weak stylohyoid and posterior digastric muscle. What do we care about the muscles? Well, if you have impaired swallowing, you might need like chopped food, minced foods, right? You might need to go pureed. You might start drooling on the one side because you can't keep the food in your mouth. Your jaw might not be coordinated to move in a certain way to chew. That can be very isolating, especially for somebody who loves to go out to eat with their friends or family members. They might say, you know what, I'm really embarrassed and I don't want anybody to see me chewing and going out. So they start disengaging in those normal activities. Dave, this one's for you, ready? The weakened stapedius muscle. It is the smallest skeletal muscle in the body, measuring only over 1 millimeter in length, but it has a huge impact on us. It is the muscle that is responsible for dampening loud noises. So if you have like a hypersensitivity or an overreaction to loud noises, this could really impact your life. I know from a personal experience with our son, he's 6 now, but when he was 2, he started getting some hypersensitivity to noises. We got him the headphones. We would go, to parades, and everything was fine. And it wasn't until he was a little bit older, he was 4, and my husband and I said, you know what, let's take him to Disney. It's going to be great. He's at a great age. He's going to have so much fun. Let me tell you, we went from thinking we were the world's greatest parents to being awful and we're torturing our son because the noises were so much for him. He was scared, and then he was so anxious that he was worried that he was going to have another reaction, that he didn't want to go on certain rides. He didn't want to go to the characters. He didn't want to watch the parades. And if you think about it, if you don't address those issues, you can easily become isolated. And if you were in Dr. Gottlieb's presentation, all that depression then starts coming on, right? So very, very small muscle, but a huge impact on our life. So what do we do about it? I think what we want you guys to get out of this is it's not a one type thing. It is definitely more an interdisciplinary approach. There's the medical pharmacological management of it, which you guys are more versed than I am in it with your IVIG and the plasma exchange and the corticosteroids. Then there's the rehab part where we fit into this. And then there's the surgical management of it, which now I'm not going to go into too much detail because you guys get a lot of this information throughout the symposium here. And you're aware of your doctor is going to go over which is going to be best for your case, correct? The only thing that I want to bring up that is a little bit different with this facial paralysis is that if you get to the point of seeing a plastic surgeon for the facial paralysis, they may or may not recommend Botox or Dysport injections. So if you're having a little bit of spasticity or there is some twitching going on in your face, they may do some direct injections to those muscles to kind of help calm them down, okay? And now I'm gonna hand it off to Dana for the second part.
So now we're going to talk about the rehabilitation treatment. And before we kind of dive right into this, I just wanted to make a little bit of a general statement. The literature actually says that electrical stimulation is not as helpful for facial paralysis as it may be for some other types of disorders. So as we go through this, we're going to talk a little about electrical stimulation, but it may not be exactly appropriate for you because the literature says that even in the acute or the chronic phases, there's low-level evidence to support it. So first we're going to talk about just facial exercises, which we'll talk about in a little bit more detail later. We'll kind of all do them together, which is what we do in therapy. We have facial massage to help kind of keep elasticity of your muscles and the skin around your face. We have biofeedback, which is for someone that doesn't have full paralysis, so they have some movement in their muscles. This has to do a lot with trying to reconnect your brain to your muscles and those signals, and it uses a form of electrical stimulation. And then you have acupuncture and electrical dry needling. And electrical dry needling is kind of like acupuncture, except you're adding e-stim into it, or electrical stimulation or e-stim. One other comment about electrical stimulation, there's different modalities of electrical stimulation. So sometimes people will use electrical stimulation for a sensory approach versus a motor approach. So think about a sensory approach would be like for low back pain. Someone would use e-stim to decrease their low back pain, which may be beneficial for some of you. But the type of electrical stimulation that we're talking about here is really that motor type of electrical stimulation, where we're trying to facilitate an actual muscle contraction of the muscles in your face. So just keep that in mind, that e-stim can kind of be used in different facets. So even if it's not appropriate for you guys in this type, it could be beneficial in other areas of your recovery. And then if someone doesn't have any type of active movement in their facial muscles, they want to use different compensation strategies to help. So some of them could be drinking from a straw, or some of them could be manually closing your mouth so you're able to chew and liquid doesn't come down the side of your face when you're taking a drink of water. Or it could be manually closing your eyes, which is what we'll talk about in a little bit. Another one is kind of pulling your cheek up towards your ears, so when you're chewing, you don't actually chew accidentally on your cheek. And the other one is to change your diet a little bit, which is kind of like what Maria was saying about having food that are a little bit smaller in bite size, softer, and add a little bit more moisture. When you're thinking about the stages of swallowing, what traditionally happens is you put the food in your mouth, right, and we use our teeth to chomp it up into small bits, but it's actually moving around in our mouth to create what's called a bolus, which is using the saliva to create this little like mound of food, this bolus, so we're able to easily swallow it. So if you're not producing enough saliva or you don't have enough muscles in your mouth to kind of create this bolus, it could cause like a choking hazard, or it would actually like fall out of your mouth if you had really severe facial drooping in your mouth region. So how do I do this? This one? Okay. Okay, so now we'll talk about a little bit more about what we do. So in occupational therapy, we really address lagophthalmos, which is a fancy term for saying that your eyes don't close all the way. Traditionally, when you're thinking about blinking, right, you have your upper lid and then your lower lid. And when you blink, your upper lid comes down and then your lower lid comes up. So it creates this like seal, which is really important to protect our eyes from different debris in the air. And this debris we can't always see, right? But an example is like if you're at the beach, because we're in Florida, right? Sand in the air, right? You may not be able to see, but there could be debris getting into your eye, but we blink to kind of counteract that. If someone has facial droop or facial paralysis, you may notice that when they close their eyes, they can't actually make that appropriate seal with their upper and lower eyelid. So you notice the sclera, or the white part of the eye, still showing. And that essentially is really imperative to detect right away, because our vision is our dominant sense. It's super important for everything that we do. And if we're not protecting our eyes, that could kind of cause some challenges down the road. So if you do notice that yourself or somebody else has this lagophthalmos where you see that white part, the sclera, the first thing you want to do, it's usually the OT or the occupational therapist that identifies it first, but our job is to protect the cornea, which is a clear, like a lens that goes over your entire eye to protect your eye. So one of the treatments is to actually have an ointment that's usually prescribed by your physician that you would put directly onto your eye, usually at nighttime, so you would just sleep with it there. Sometimes patients will say that after they use the ointment in the morning, things get a little bit blurry because of the ointment, but as the day goes on, it kind of subsides and it doesn't bother them as much. Other times, sometimes people will say that the ointment irritates them, but usually that blurriness goes away as the morning progresses. the way that I kind of think of it is that if you had glasses on your face and we smeared it with ointment or like a Vaseline or something, and then you wiped it away, there's always going to be that like a little bit of residual on that lens, so it blurs it out. So that's kind of the same thing that's happening with the ointment. So that's one treatment, but let's say that you don't like the ointment or it irritates your eye a little bit. They actually have what's called an eye bubble, which is kind of a funny name, but essentially what it is, it's a clear ball that's kind of like cut in half, so you could have two if you're bilateral impact. And it has adhesive on the end of it, which is meant to go on your skin. So people will put these eye bubbles on, so it kind of just looks like this big, clear, like bulb on their eyes, and they wear that when they sleep, and then they take it off in the morning. You can get those at any like pharmaceutical stores. I'm sure Amazon has it, because Amazon has everything nowadays, but that's another option. And then usually to continue to protect your cornea or your eye, during the day we recommend that you wear glasses, even inside for the debris. If you don't actually wear glasses, you can always purchase non-prescription glasses that you can wear, and definitely wear some type of eye protection when you're outdoors, because again, the debris is going to be a little bit more heightened outside. Occupational therapists also help with neuromuscular re-education of the orbital muscles, so just working the muscles around your eyes, which we'll talk about in a little bit. Physical therapy, again, also helps with the neuromuscular re-education of the facial muscles, along with speech therapy. But what's unique about speech therapy is that they really determine what's appropriate for you related to swallowing strategies or helping you with speech, because if you do have really severe facial paralysis, when you're speaking, we really rely on moving our mouth and our lips in certain ways to get certain sounds out, so that might be impacting like your speech. So the speech therapists really hone in on you being able to manage your food appropriately in your mouth and being able to speak clearly. So now let's get into the fun part. So we can actually all kind of try this together. So if Marie and I will kind of demonstrate, and then hopefully you guys in the audience can try as well. So we kind of divided the facial exercises into different parts of your face. So we have a few for the upper, and then like the middle, and then lower parts of your face. These are really just a couple just to kind of get your toes wet in it. There's definitely a lot more, but I think working with an occupational, physical, and speech therapist, they can kind of really hone in on what you're having specific challenges with, and they can add more of a personalized exercise program for you. So the first one we're going to talk about is raising your eyebrows and furrowing them. So if everyone kind of puts their hands like on their forehead and just kind of raise your eyebrows, you can kind of feel like your skin and your muscles actually moving, right? So when you're doing this type of exercise, you want to almost act like you're surprised and your eyebrows go really, really high, and then you want to furrow them back down like you're really mad at somebody.
Think about being mad at Dave last night for those
Trivia question.
They
were really hard. I think I got like 2. And a lot of the times when someone has facial paralysis, right, like they might be able to get their eyebrows up a little bit, but not fully all the way. So you can kind of do what we like to call active assist, where you're actually helping your muscles move a little bit. So let's say you lift your eyebrows up, but you can't get them all the way up. You can kind of facilitate some of that motion with your fingers to get the entire motion all the way. And that is essentially kind of trying to retell your muscles, like, hey, you're only getting halfway. This is where I need you to go. So it starts to remember like what it should be doing. So with all of these, you can kind of use a little bit of an active assist technique. So the next one is wrinkling your nose. So to do an active assist of this one, you can kind of put your hands a little bit on your cheeks, and you're kind of bringing like your cheeks and you're furrowing your nose a little bit and bring it back down. And even if you just kind of rest your hands on your nose like how I am, you can, and kind of wriggling your nose, you can actually feel like the facial muscles moving, which is kind of cool. Another one is opening and closing your eyes. So this is one specifically related to the lagophthalmus that we were talking about if you have trouble fully closing your eyes. So you're essentially going to try to close your eyes as tight as you can and then open them really, really wide. For this one, you can assist yourself. You just want to make sure that you're not actually like poking your eye, of course. So you can kind of just gently put your hand or your fingers down a little bit below your eye here. And as you squeeze, you're just gently kind of bringing your skin up and then releasing it when you open them nice and wide. One of the things that I did forget to mention too, that if you aren't able to close your eyes, this is a really good exercise to kind of do throughout the day. So of course, making sure that your hands are clean because you want to avoid infection is really important. But just generally, like always closing your eyes throughout the day is going to be helpful because you're getting the same effect that you would get if you were able to close your eyes or blink naturally. And then we have smiling of the face, so you can kind of like hold your cheeks and feel like your smile, and you can kind of help pull your cheeks up towards your ear to smile and then relax it. And then you can kind of blow air in your cheeks and then make a little like fish face. Let's see everyone's fish face, or like your kissing face, right? Because you're working all these muscles around like your mouth. So those are some examples of some exercises. And again, the physical therapist, speech therapist, or OT that you work with, they can kind of give you more specifically based on where in your face you're having the most challenges. Yeah.
And then for this area of the face too, this is where the massage techniques come into play too. A lot of times people will hold a lot of tension because they'll clench their teeth down. So these muscles in here will get really, really tight. So when having your hands in a similar area, you're just doing little circles along that muscle, like especially if you clench your teeth and you feel that tightness. It's kind of hard to do and talk at the same time, but you feel that tightness. Those are the areas that you want to relax your face and do small little circles along that muscle belly to help relax those muscles. Because a lot of times people will get a lot of that tension and they might have some pain behind, like at their jaw, okay?
And then lastly, let's say all of these other types of treatments that we already talked about wasn't successful for you. There is surgical treatment for facial paralysis, but the Facial Paralysis Institute really recommends that this is done in the chronic phases, so either 8 months or even longer out to even be considered. When you're thinking about surgical intervention for facial paralysis, there's a lot of other things that you really want to factor in, right? You have healing time, there could be some contraindications, and there's a chance of infection when this happens. So there's a little bit more of a risk if you are thinking about doing some type of surgical intervention. So it's really imperative to make sure that you're talking to your neurologist if this is even appropriate for you, and making sure that if your neurologist agrees that this is something important that would be beneficial for you, making sure you go to a plastic surgeon that actually specializes in facial reconstruction due to facial paralysis. You don't just want to go to a facial or a plastic surgeon that puts in breast implants or does like a tummy tuck. You want someone that really specializes in this to making sure you're getting the best results, because it is a really complex, challenging surgery for people. So we'll kind of dive into some of the surgical treatments. A lot of times people have heard of Botox injections, and Maria had mentioned a little bit before that sometimes people can have some tightness in their muscles or muscle twitching, and putting Botox in there would essentially help relax the muscle a little bit, which may not be as widely used among the GBS and CIDP population, but it's definitely a treatment option. They also have muscle reanimation surgery, which essentially what they're doing is if your facial muscle isn't working at all, that nerve isn't alive or working, right? So they're essentially trying to take that muscle and reattach it to a nerve that works, which is pretty crazy, right? To try to see if we can get those things firing again so they work. And then they also have nerve grafting and transplant, which essentially is the same thing of trying to give that facial muscle healthy nerves to work, but you're getting that nerve or healthy tissue from a separate part of your body or even from someone else. There's also selective neurolysis, which is sometimes releasing a particular muscle. Like if a muscle's super, super tight, they'll actually release it so you're able to smile. These options that we kind of just talked about really focus on the functionality of moving your face. So being able to smile, being able to manage your food a little bit better, because it's really trying to increase the motor aspect of your face. And then we get into more facial surgeries that just help kind of improve your symmetry of your face, which may not necessarily help with movement, but it's helping with the symmetry. So most of us have heard of brow lifts, eyelid surgery, and facial lifts. They also have facial slings where they can kind of reattach like the muscle in a certain way to kind of hold it up, kind of like a sling. And this essentially just gives your facial expression just better symmetry. As you can see, like in this picture here, this is a woman that actually went through surgical treatment to correct her facial paralysis, and you can see like how amazing she looks, which is really exciting, you know. One of the last things that I just want to mention about the surgical treatment is that, again, this is one of the last resorts if all of these other options didn't necessarily work for you. But if your facial paralysis is really significantly affecting you functionally, being able to talk, communicate with your loved ones, being able to eat and enjoy your food, it may be able to be covered by insurance because it's affecting you functionally and really hindering your quality of life and your ability to participate in daily activities. If it's more for, let's say like your facial paralysis may not be affecting you as much functionally, but emotionally you would feel a little bit more confident in correcting some asymmetry that you have, it may be considered more a cosmetic procedure, which wouldn't be necessarily covered by insurance. And again, these procedures are very expensive. So just keep that in mind if this is something that you in the future want to maybe look into. Then I'll pass it back to Maria just to finish us off.
You would think Dr. Dan Gottlieb would have paid us to put this in here. I promise you, we had no idea what he was going to talk about. We just happened to come up with this picture of smile in the mirror. Do that every morning, and you'll start to see a big difference in your life. And if you heard yesterday, Dan had such a powerful message of look at yourself in the mirror. Look at that person in the eyes, right? Well, now we encourage you to not only look in the mirror every day and look at that person in the eyes, but smile. Smiling has such a huge impact on our emotional health that's probably one of the best exercises you can do every day.